So yeah, thank you very much, Reinhard. So he introduced me already. So I tried to combine many words in one. So I'm coming originally from science. So I studied physics in the Technical University in Munich. I studied and finished it. And then I spent the last 10 years in the medical sector, the medical technology. And I spent a couple of years in the research as well. And then I went more and more to the medicine. So I'm a paramedic and I'm also a Heilpraktiker. So I finished the naturopathy. So Heilpraktiker is for the people who are not from Germany and don't know what is it. It is a practitioner for complementary and alternative. It is a very old tradition in Germany since 1939. And so I have my own practice in Munich, my own doctor office here in Munich in Bonghausen. I will speak about nutrition oncology today. And many times I like to interact with a publicum. So my German is better than my English, but I try my best. So I try to interact with everyone. So that's why for me it's interesting to know. I have my first question on you. Who thinks that nutrition can influence somehow cancer? Very nice. I like this. So, a short introduction about my presentation today. I will speak mainly about the key factors, key risk factors about which we can modify. And I concentrate in my presentation mainly on cancer prevention and mainly survivor after cancer diagnosis, so cancer survivors. But of course, many factors here are important also for the risk of recurrence and for the therapy itself, for the side effects as well. So this presentation is scientific, so I'm using the latest evidence-based and cancer-specific guidelines and recommendations from the whole world, so worldwide. But I choose the very simple language to be accessible for general public. So for me it's very interesting and very important that all of the scientific information reach also the patients and the general public. I speak about prevention, so actually to reach everyone else. So the scientific sources which I use today of information, so you can see many different organizations worldwide. So I used sources from the World Cancer Research Fund, for example. I used the American Cancer Society. I think this is maybe also interesting for patients and for people who are just in general interested. You can find everything on those websites, on those pages. Everything is accessible for you. I used also all of the German, or not all, but many German cancer society as well. So I'm speaking about the main guidelines and recommendation in cancer and prevention. And I used, of course, also different studies and articles and papers from the National Library of Medicine, the so-called PubMed database. So many people know it here, but many don't know it. So for the patients, it's interesting. They can read everything. So it is open source. And also the patients can have access to the public, to the studies, to the scientific articles, and can read by themselves. So I will concentrate today. There are many different risk factors. So many different risk factors about cancer. So, but I concentrate on more or less 5, the most important factors, the key factors. Why they're important? Because everyone can influence them. So everyone can change them. I will speak about nutrition. It's a big part of my talk today, especially nutrition healthy patterns, what the whole world is recommending. All of the associations, they are very similar, so that's why I summarized all of the recommendations, all of the papers in one talk, but all of them are talking about the same or very similar. So the first is the nutrition in general. The next one is the body weight control. This is also a very, very important factor. I will speak about physical activity and additional factors like alcohol and tobacco. So nutrition is important, but it's not the only one factor which is important. So my next questions on you is, what do you think when you look to those, let's say 5 factors? They're very basic, they're easy, maybe everyone knows about it already, maybe yes, maybe not. But when you look to them, what do you think, what is the research outcome? What is the percent of prevention? So when we use and combine all of those 5 factors, how much can we prevent the cancer in percent? Or how many cancer types can we prevent? Or how many cancer deaths per year can we prevent? What do you think? Is here someone who want to guess? How many percent? Only with those 5 easy things which we can use every day. How much? Okay, the science is a little bit skeptical, not 80, a little bit less. 50.
It's known that the physical activity is as good as chemotherapy. There are scientific researches.
Exactly. Yeah. So exactly. So they say between 30 and 50%. So this is really very important because so I will show you here. So this is from this is the American Cancer Society guideline, which I'm using as well. This is the old one. This is from 2012, but I used also the new one, but I like just this quote here, that's why I'm showing it. I used also the latest one, 2022. They have those guidelines every 5 years. And what the Cancer Society is saying, so they say, okay, for the most Americans who do not use tobacco, so let's say they don't smoke, the most important cancer risk factors that can be changed. So this is a very important message to everyone. It can be changed. Our body weight, diet, and physical activity, for example, and the World Cancer Research Fund estimates that about 20%, it was 10 years ago, it was 20%, now it's a little bit more, of cancers diagnosed in the US are related to body fatness, physical inactivity, excess alcohol consumption, and or poor nutrition, and thus could be prevented. So this is actually a big message and very interesting. You can see here the statistic of the World Health Organization. So, for example, in 2020, there were 10 million deaths due to cancer. This is only 1 year. Okay, maybe it's interesting. The most common cancer types were breast, lung, colon and rectum, prostate, skin, stomach, and liver. But the next 2 sentences are so important to me, and this is also my message for today, for my talk. So between 30 and 50% of all cancer, and all of the organizations worldwide have the same statistics, they say the same. Of all cancer cases are preventable. This is a huge number. So 10 millions, 30% or 50%, it's something between 3 million and 5 million cases, people's lives per year. And this is so easy. So, and this is, they can be prevented, but they are prevented by avoiding risk factors. This is the first one, risk factors, we will speak about this today, and implementing existing evidence-based prevention strategies. This is the second message today for me. My first message is really to say, okay, it is easy. You can prevent between 30 and 50% like a patient. So you have your life also in your hands. So you can do a lot about preventing and later also preventing recurrence and so on and so on. And the second message is those factors to be used by colleagues, by doctors or medical staff, so they can implement it. This is also a big problem. I will show it later. That those recommendations, which are well known worldwide, they are not implemented nowadays in the treatment of cancer. And the last one, only 30%. So those between 30 and 50, there are different factors. So here are calculated also air pollution, he's calculated also chronic infections, and so on and so on. But only 30% of deaths are exactly of those factors which I will speak about. Those 5 factors, it makes 30% of death: tobacco, alcohol, high body mass index, low fruit and vegetable intake, and lack of physical activity. So I concentrate on prevention here, firstly. So the first one, the first recommendation is, let's start with the nutrition. So the nutrition healthy patterns which are recommended. On first place is include plant-based foods. So there are many the nutrition is very controversial topic. So everyone is speaking about nutrition. There are many different ideas about nutrition. We have ketogenetic, we have vegan, we have macrobiotics, we have so many different. But the most interesting thing is, I was reading many papers. You will find papers for everything, each opinion. And the most interesting thing is that everyone has the same opinion about those points here. The whole world have the same opinion. Basic recommendation, but everything is the same. This was important for me. And so everyone recommends plant-based foods. So they really say, they also work with numbers, and they say, okay, we recommend 50 grams of variety of colorful vegetables and fruits each day as a prevention. Of course, there's something else if you have insulin and so on. I don't speak about treatment now, I speak about prevention. They recommend legumes and whole grain like buckwheat, millet, quinoa instead of refined grain. They recommend fibers. Okay, fibers in general, they're in the vegetables, fruits, legumes, whole grains, they're included. And they're linked, so the research say they're linked with a lower risk of some types of cancer, especially colorectal cancer. So, for example, or overall evidence suggests in general lowering of the following risk, cancer, like lung, mouth, pharynx, larynx, esophagus, stomach, colon, and rectum. So they're directly linked to those to lower the risk. So what is a nutrition healthy pattern? So a nutrition healthy pattern means the first one is what to include in my diet, but the next thing is what to exclude from my diet. So include plant-based food, for example, but the next recommendation, the last point, is which foods to limit. So which foods are linked to a higher risk for cancer and developing of cancer. Are processed foods, high-calorie foods, high-sugar foods, fried, salt-cured, smoked, pickled foods. So this is just recommendation also for the patients. So the next point what I'm speaking about in those guidelines and recommendations, which are based on hundreds of different scientific papers. They say as well there is a big discussion about the fats. So the recommendation in general is also to choose healthy fats. So what is healthy and what is not healthy? So they speak about different types of fats. We heard the presentation yesterday about omega-3, for example. So one healthy fat, unhealthy aldosaturated one, trans fatty acids, like it's included in meat, dairy, palm oil, or processed snack foods. The healthy fats are like fish, avocado, seeds, nuts, with a lot of omega-3, for example, like yesterday we heard in the presentation. So there are different studies, and they reported in general, the first one, that people who live in countries with higher amount of fat in their diet, like US, for example, they have higher rates of breast, prostate, colon, and other cancers. So this is interesting. And in general, study reported also association related to mortality after breast cancer, fat and mortality after breast cancer. They speak also about meat and salt as factors, important factors in our meal. So meat is also a big topic, yes or no, how much and so on. The official recommendation is to reduce the meat, especially avoid red meat, like beef, pork, lamb, and processed meat products like smoked, cured, and etc., salty, and etc. And they have one recommendation. Some papers say not more than 300 grams per week meat. Another say not more than 500. Something between 300 and 500 grams per week meat, and not more is the recommendation per week. Eating large amount of meat is linked to increase the risk of colorectal and stomach cancer. There are many papers about that. Not only which kind of meat, but it seems like it's also important the way how we prepare the meat. not only the type, but also the way how we prepared. So they found out, the researchers, the scientists, that frying, broiling, grilling meats at very high temperatures form chemicals. They are very long to say. You can see it. Polycyclic aromatic hydrocarbons. Okay, I made it. And heterocyclic aromatic amines. I think they are also famous in the science. They make many research about it. And this made increased cancer. So I was reading, especially, there were different studies about the temperature. So they made a different studies between temperature of preparing meat between 150 degrees Celsius and 350, and they saw that those chemicals, they increase rapidly and higher temperature. They found also already some at 150 degrees, but much more at 300. So the recommendation is not to prepare this meat at very high temperatures. It increased cancer risk. So salt is the next point here. In general, so there are good evidence that large amounts of foods preserved by salting and pickling carry increase of stomach, nasopharyngeal, and throat cancer. So. Okay, this was the general to nutrition about the worldwide recommendation, and the next one is additional risk like alcohol and tobacco, like smoking. So the general recommendation is not to drink alcohol, but I think many things we know already, so it's we can drink, but it's maybe sometimes not so healthy and so on. The most of the recommendations are basics, so we know it. But it was interesting that the papers, they say if they drink alcohol, so limited to 1 drink per day. So this is something like a small beer or a small glass of wine or 45 milliliters of hard liquor. And there are many papers about it, many scientific papers about how alcohol can cause cancer. And you can see here many different types of cancer. So alcohol is linked, drinking of alcohol is linked to many cancer. Mouth, pharynx, larynx, esophagus, liver. Liver is clear, everyone knows about it. Colon and rectum, breast as well, not Hodgkin lymphoma, pancreas and stomach. The next interesting is the tobacco, the smoking. So the smoking, I think, is also clear maybe for many people. That is a general recommendation. So don't smoke too much or smoke as less as possible or just keep it. So interesting is that the science says something similar. So smoking is leading cause for several types of cancer, like lung, bladder, pancreas cancer. And what was interesting for me is that the combination between those two factors, so if you smoke and drink, so the combination of both alcohol and tobacco, increases the risk of some cancers many times more than the effect only drinking, either drinking or smoking alone. So this was for me interesting. I didn't know that this risk increased so much more than if you do it separately. So one interesting thing is here, I want also to ask, do you know about this link? Do you know about this relation between body weight control, the body weight, and about cancer? How many people know about it already? Yeah, to be honest, I underestimated a little bit. I didn't know that it's so important. I knew that it's important, but I didn't know that it's so important. And this was also interesting for me, and I want to share it with you. So there's a recommendation for cancer prevention and also later as well for cancer survivors. Of course, after cancer, in the most of the case, we have underweight, not overweight. But the healthy weight is crucial here. So the recommendation is So how we measure the healthy body weight? We measure it with the body mass index. Maybe the most of you know already about it. The healthy body mass index, the recommendation for now for adults is within the range between 80.5 to 24.9. And you can see here the formula, how you can calculate it, or we can calculate it as a therapist. So there are different papers, different scientific papers and articles about overweight. So I use here massive overweight. I found many articles also about overweight, not massive. Also, already it starts with overweight. But the massive overweight is really visible how it increased the risk of several types of cancer. You can see breast, colon and rectum, endometrium, esophagus, kidney, and pancreas. And another part of the scientific papers, they say also likely raises the risk of other cancers, additional to it, like gallbladder, liver, non-Hodgkin lymphoma, multiple myeloma, cervix, ovary, aggressive forms of prostate cancer, male breast cancer, cancer of mouth, throat, and voice box. So the papers are linked to it. So, and here physical activity is the next one. So the next point, and also the last one of those 5 crucial and key factors for prevention of cancer. As you can see here, so as you also already said, so physical activity is not important also for prevention, but it's important also for acute phase and aftercare. So really, nutrition is important, but only nutrition alone is not enough. So physical activity, so many papers say physical activity is exactly as important as nutrition or much more important. If we eat very healthy, but we sit the whole time, we will not see a big effect. So the combination of all of those is important. So the recommendation here is reduce sitting time. So this is clear. And this is interesting because they say the sitting time today is the new smoking. So they can see, and of course me as well, we can see that the smoking rate is decreasing with time. So the people, they're getting clever and they say, I don't think maybe it's better when I don't smoke. And many young people, they don't smoke. Okay, some they do. But the interesting thing is much more start to sit, much more sitting, much longer than actually is healthy for us. And this is the new smoking. So the recommendation is to reduce sitting time. And the recommendation for exercise, for movement is for adults at least between 2 and 5 hours. 2 and 5 hours per week of moderate intensity. It is something like walking, Spaziergang, or between 1 and 2 hours of vigorous intensity each week. And also, additionally, the recommendation is to muscle strengthening activity 2 or more days per week. I think when we think now, okay, if I'm doing this really, if I'm doing it 5 hours, if I'm going walking 5 hours this week, yeah, it looks like, yeah, we are getting to the sitting time generation. So why is physical activity so important? I wanted to ask, but I have it here. So actually, there are so many different factors which improve our health and also the prevention of cancer and cancer itself, like physical activity improve immune function, reduce inflammation, enhance the body's ability to repair damaged tissues, which is of course very important also for the cancer itself. And here you can see different, I have different examples. For the scientific for the scientific papers, the physical activity may reduce the risk of several types of cancer: breast, colon, endometrium, prostate, bladder, esophagus, and stomach, and may also affect additionally the risk for lung, head and neck, liver, pancreas, and ovarian. So on this place, I want to do something with you. Can you please stand up? All of you. Oh, this looks so nice. So, and now please, how to say, stretch your hands. And now stretch a little bit up. Oh, it's so good. And now go to the right. Stretch, 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 stretch. Yeah. And now go to the left. Oh, that's so good. Okay, and now raise only one hand. Tap on your shoulder, thank you, you're great, you moved today. This is so good. Thank you very much. And then, yeah, exactly. No. This is the beginning. But this is very important. And then I'm thankful that I moved my body. Thank you. That I took my time for myself. Yeah. So, and then here I have also the recommendation, the general recommendation for cancers from Cancer Research Fund. It's similar, it's actually completely the same, but I just use it as a summary. So, to speak one more about that. So, recommendation is plant-based foods, increase plant-based foods, reduce calorie-rich and sugar-rich and salty foods. Avoid eating red and processed meat. Be careful not to eat moldy food, so it was not before, this is something additionally. Keep normal body weight, get physical exercise every day, so we did it today. And drink little or no alcohol and limit tobacco. So they recommend exactly the same. And here also the same recommendation, but a little bit in pictures from our American Institute for Cancer Research. So there is no big difference, like look to your diet, look to your weight, look what you're eating, limit alcohol, limit fast food, and so on and so on. So actually very, very easy, right? And influence at least 30% of cancer risk and cancer development. So, and a short summary here. It's important, or for me it's important to say the combination of all those key factors is crucial for the prevention. So as I already mentioned, not only one, but if we can combine all of them, it's increased the probability for prevention, for healing, or for cancer survivors after that. Interesting is also for me, or maybe for everyone, there is no one-size-fits-all diet for cancer therapy. So I spoke today especially for prevention and for cancer survivors. There are many papers and many different opinions about cancer therapy, which kind of this kind of cancer is this type of nutrition diet the best one, and so on. Depends on the cancer itself. That's why individual approach is necessary. And of course, a side effect is following those guidelines affects not only cancer, affects also other diseases like heart diseases and so on. And now I'm coming to my last slide for today. For the conclusion for today is we show very easy parameters, very, very easy factors. Everyone can do it by itself. We can be responsible and we can be independent for our prevention. We can do a lot in our lives to prevent it, and we can prevent it between 30 or 50% of cancer risk. This is a lot. And my message again here, this is also upheld from the scientists, not only from me, but the scientists, they are saying in many different papers, so like here this quote, so despite a large body of supportive evidence, so we have a large supportive evidence already, for example, like sports and exercise therapy and nutrition therapy are not included in the standard treatment plan of cancer patients. So we know everything, we have it everywhere, everyone is speaking about it, but somehow it's not implemented in the treatment plans of cancer patients. So this quote is from this year, from last year, 2022. And that's why my appeal and my message for today, I want to encourage patients and encourage also therapists to include those easy recommendations in their therapies. Thank you very much.
Es gibt keine Patienten, es gibt keine Therapeuten, es gibt nur Menschen.